Hi, everybody. This is Dr. Michael Richmond, double board certified general surgeon and cardiothoracic surgeon. Just wanted to touch on a brief topic today, and the topic is, does a needle biopsy of a solid tumor in your body spread possible cancer cells? And the answer is no. That's a brief answer. So, a friend of mine who's a physician texted me this morning that he saw something on TikTok or Instagram, which already makes me pause, that you should never have a needle biopsy of a solid mass in your body because you're going to spread cancer. First of all, a little bit about TikTok or Instagram. Um, I think everybody knows that anybody can say anything, but you need to do your own research and um, see what the real literature says. Okay. Number two. So whenever you have a solid tumor, we need tissue because we need to say, is it benign or is it malignant, which means cancer? Type of biopsies. You can do a needle biopsy, which is usually CT guided or ultrasound guided, which is actually putting a needle in and getting cells. Next would be a core biopsy, which is a thicker needle, and you're getting more tissue. There's also an excisional biopsy where you're excising the whole mass. And then there's something called an incisional biopsy, which is you're taking a piece of it. In other words, if the tumor's so big and um, you can't get it with a needle, or it's not going to be yield enough tissue, you need to do an incisional biopsy. But quickly getting back to a needle biopsy. So the literature is pretty definitive and it's been studied extensively. So for breast masses, for example, in the large trials, a needle biopsy has been shown to cause cancer cells to be along the needle track in approximately 0.7% of patients, and that's in multiple studies. A core needle biopsy in breast mass, which is more, it's a thicker needle, has not been shown to decrease progression-free survival and overall survival in a study of 9,900 women. Okay, so forget that. Then in terms of solid tumors in other parts of the body, for example, sarcomas, which can be in extremities or basically any other place. They're just big solid tumors. The incidence of spreading of the tumor is 0.38%, two major studies, and the incidence in another study of doing an incisional biopsy, which sometimes you have to do, can be up to 38%. Okay, so just please get that out of your head. The most important thing to do if there's a mass is prompt diagnosis. And we like to do the least invasive way to do it, and that will yield the most information because we got to get you diagnosed and on treatment promptly, hopefully within 30 days, because that'll affect your overall survival. All right. Hope this was helpful and I hope you have a great day. Thanks.